So this is a video about tennis elbow, but before we get into that, we need to tell everybody about how one of my earliest memories is going to the store where you worked, Alpine Market, right here in Auburn. People like Frank Key and Gordon and Linda, and maybe somebody watching will even know who we're talking about.
Yeah, way back.
Yeah.
Way back, or late 70s when I started there. So.
Yeah, and I would have been young.
Yeah.
Going there with my mom to get groceries. Good memories. So anybody else remembers Alpine, write it in the comments about your memories of Alpine and Frank and Linda and Gordon and the gang. Tennis elbow usually is associated with the idea of playing tennis, the backhand where your wrist is doing this action, dorsiflexing. Is there some kind of activity you've been doing where your wrist has been going like this, or?
Bowling probably would be
okay.
The major one we pull every week.
Okay, the bowling may have played a role. And what's happening is these tendons that come from the elbow and go to the wrist and pull the wrist back are attached here and up here, and then you have a muscle in between. And of course we tried the treatment with the band that goes around here, not where the pain is, but past the tendon where there's the muscle, to try to anchor it here so that when you do this, all the pull of the muscle is between here and here, and that just didn't quite cut it for you.
No.
So when that doesn't work, we go ahead and give a cortisone shot right to the area of the tissues around the tendon. We don't actually go in the tendon, but we go near the tendon with some cortisone, and of course we use a little bit of anesthetic to help to numb it up. And you should have immediate improvement with the anesthetic, be able to move your wrist and say, oh yeah, it doesn't hurt like it did. And typically what will hurt is pulling your wrist back, up like this, against resistance, especially if I push there at the time. And the reason I do this is not to hurt you, but to find the exact spot, to remind myself of the anatomy, which I should, that's where it attaches. You can see that bony prominence there. And we'll even, just for making the whole rest of the procedure a little more focused, well, it's done many ways, but my way of doing it is to give a shot of anesthetic to start with, and then leave the needle in place while I put the cortisone in, and I'll explain why I do that. But first let me find the exact spot. Yeah, that's it, isn't it?
Yeah.
I don't even have to push very hard. Okay, the shot's going in the skin, not to the bone. We don't go to the bone. I pull back to make sure we're not in a vessel. I also see how easily the medicine goes in to make sure we're not in the tendon, and it's going in real easily. It stings, I apologize. I'm going to remove that syringe, put on this one. Again, pull back, make sure we're not where we're not supposed to be. We're fine. Finish by putting in all the cortisone. And now I'll explain why the mysterious switch of needles. The reason is because if this cortisone were to be in the needle as it pulls out, it can leave a tract where it passes through the skin. And cortisone leaving a tract in the skin can actually make a sinus, a communication between this area inside of you and the outside of the body where it can drain out fluid from the body. Okay, so now I want you to move your wrist around and see how it feels.
Actually, it feels fine.
Okay.
I mean, there's no...
Pull against my hand here. Nothing? And it's not just pulling back, it's also twisting too.
Yeah, that was where, with the elbow, it was more of the vertical kind of twist and lift.
Yeah, with the bowling ball?
Yeah.
So what we'll have you do is absolutely nothing. The medicine's going to do the work. It's numb now, will be for about 5 hours. When that wears off, it's going to hurt again because cortisone doesn't kick in immediately.
Okay.
It can be days, it can even be longer than a week, rarely. So we'll look for it to improve over the coming days. Thanks for joining us. Subscribe if you haven't already. Share with your friends if they're interested in this or have this problem. Until next time, this is Tom and Dr. Mark Vaughan telling you to stay in good health. Do you mind if I use your name?
No.
We can shoot the whole thing again without your name. Except for the shot.